My name is Dr. Konrad Grosser. I'm a consultant cardiologist. I'm one of the senior interventionalists. High blood pressure, thank you very much for the question, is a very, very common condition indeed. In the UK, 1 out of 3 male persons has high blood pressure. 1 out of 4 of every woman has blood pressure. Unfortunately, a large percentage of patients do not know that they have blood pressure. So for every 10 patients that have blood pressure, about 7 are out there not diagnosed. Because blood pressure is a bit like a chimera. You cannot really tell unless you check. So it's a very simple investigation you have to do, often available in pharmacies or in health stores, but also with a GP, of course. And all you need to do is make an appointment and measure your blood pressure with what we call sphygmomanometer, or commonly known as a blood pressure cuff. It often is very, very simple to access those diagnostic tools, and the reading should be taken when you have had 5 minutes of rest, or not when you just rushed up the stairs or something like that. You need to really rest, because what we're really interested in is the resting blood pressure. Once you've done that, you should repeat the measurements a few times, because a one-off measurement gives you only a snapshot, but blood pressure is very variable, so you can have quite large fluctuations in a normal day, and we want to have 2 or 3 measurements in order to give us a little bit of an idea what the average resting blood pressure is. We also know that, for example, in office situations, because one is nervous, patients often have a higher blood pressure. So there is a way to diagnose it at home, and you can, for example, borrow from a friend a cuff or buy ones. They're not very expensive anymore. Or your GP or your specialist may want to prescribe you a 24-hour blood pressure monitor which you take home. That's a very good question. I want to demonstrate that to you. It's very, very straightforward. All you need to know is that you have to be relaxed, which we have been, luckily, Louise. And I have a volunteer here, if I may. Thank you very much, Holly. So this is a blood pressure cuff that can be fitted even over a shirt or so. And all you need to do is now to relax the arm, please, for me. Think of something nice, and then press a button. And the machine then will automatically inflate, and at the end of it, it will show you the numbers, i.e. your systolic blood pressure, which is the upper number, and the diastolic blood pressure, which is the lower number. The normal values for systolic blood pressure is between 120 and 140, and if you're a little bit more, let's say 60, 70 years of age or higher, then 150 would be acceptable. But for the vast majority of patients, 120 to 140 would be the desired blood pressure range for the systolic blood pressure. The diastolic blood pressure is the lower value. 70 to 80 would be the normal value here. So Holly, we have a perfectly good blood pressure in your case. If anything, it's a little bit on the lower side. It's 115 systolic and 77 diastolic, so that's perfect. It is, unfortunately, the dangers are not immediately visible or feelable. The difficulty with blood pressure is that it doesn't make you feel unwell. So people have it, but don't know they're having it. It is a little bit like a constant water drop that is going onto a stone. It will have an effect over many years. So if you have just 1 week of high blood pressure, you'll be fine. But if you have years after years after years of high blood pressure, which is untreated, then your body will react to that. There are certain adaptive changes, but there are also certain changes where the body then fails to keep it under control, and damage will happen. The main organs where the blood pressure can cause very significant damage, of course, is the heart. That's where I come in often with heart attacks as a heart specialist, but other organs are also affected. One of the most commonly affected organs is the kidney, and we can see that the kidney changes morphologically, but also the eyes can be affected. So the blood vessels in the eyes will change, and also you will have bleeding into the background of the eyes, and if untreated it can cause blindness. But the most common problem with high blood pressure is, in fact, the most commonly affected organ, in fact, is the brain, and it is a major risk factor for strokes and bleeds in the brain. There are many options available for patients. Number one, of course, is to reflect on your lifestyle. There's a major influence with diet, and there is a diet which addresses that. It's called the DASH diet, capital D-A-S-H. That will help you to identify foods to prefer over other foods in order to avoid negative influence, for example, high salt loading. There are other ways of lowering the blood pressure. Weight loss, for example, is a very important part of our therapy, because with increasing body volumes, you will also increase your blood volume. But the vascular bed in your body is limited. So if you have more fluid and you put it in the same space of your blood vessels, it will raise the blood pressure. So reducing your body weight is a very good way, an effective way, not only to make you feel better, but also to reduce the blood pressure. Sport can help. Often one has to be a little bit careful with sport when the blood pressure is uncontrolled. You may need to have medications. And in terms of medications, there's a plethora of medications available, and you have to find the one that suits you best. Blood pressure is also sometimes caused by certain underlying conditions. About 90% of blood pressure patients, we don't find a reason why their blood pressure is elevated, but about 10% of patients, we can actually find a cause why the blood pressure is elevated. Particularly interesting for us would be to find patients that have been diagnosed very early on, rather than their 50s, 60s or 70s. So the young hypertensive patients, that would be one that I'd be very keen on identifying whether there's an underlying condition that causes this. And also patients that are resistant to blood pressure therapy of at least 2 or 3 drugs. So these are the resistant hypertension patients, where because of the resistance, there seems to be a higher probability that there's an underlying cause. And analysis need to focus on blood vessels, but also on endocrine tumors, such as adrenal adenomas that produce hormones to elevate the blood pressure. I think the first port of contact would be to discuss it with one of the healthcare professionals you trust. That could be your GP, and obviously we are here at One Hospital in Ashford, would be very happy to help you as well. There's a telephone line you can ring and make appointments, very straightforward. But the key thing really is to measure your blood pressure.